We're going to begin the YouTube tests both in Spanish and in English. I'm going to begin speaking in Spanish so that the interpreter can go to English. I'm going to speak now in Spanish. Please, where I'm going to begin. We are going to begin today the last day of the Global School of Migration and Health. We are going to test the system.
Chequen sistemas de YouTube si están funcionando. Si escuchan mi voz en español y el traductor en inglés. 1, 2, 3, 4. 1, 2, 3, 4. Por favor, levanten su mano si se escucha. ¿Se escucha bien? ¿Se escucha bien? ¿Se escucha bien? ¿Estoy hablando en español? ¿Estoy hablando en español? Ah, ¿pasa algo? ¿Pasa algo? ¿Escuchan mi voz? ¿Escuchan mi voz? ¿Está bien? Levante su... Sigo hablando. Hoy vamos a tener un día espectacular. Mucha gente va a venir hoy y vamos a tener un evento súper exitoso para finalizar la Escuela Global de Migración. Hoy nos regresamos todos.
Hope that the upcoming event might be as successful as this one. We have yesterday more than 1,500 people connected. And we also have, the day before yesterday, 1,700 people connected. So what is going on with the system? We are today crossed, receiving both languages in the same channel. Maybe a crossed cable. 1, 2, 1, 2. Hello, can you hear me? Can you hear me? Is the system still crossed? Please confirm. 1, 2, 1, 2. Can you please confirm? 1, 2, 3, 4. Thank you, Mr. Interpreter. He can interpret what I'm saying, anything I may be saying. Let's see. Please raise your hand if the system was corrected. It's not corrected. Was it corrected? 1, 2, 1, 2. Please advise whether the system has been corrected. Is it heard okay? The technician says that it's okay. 1, 2, 3, 4, 5. 1, 2, 5. The reason for the pelican is difficult to see. His beak is clearly larger than there's a need to be. It's not to bail a boat with. He doesn't own a boat. It's not a scoop for eating soup. It's not an extra shoe. It isn't. This is the Spanish channel interpreted into English. Sitting in Spanish, interpreting into English. Spanish, English. They are not able to hear correctly when I speak in Spanish, there's some type of issue. 1, 2, 1, 2. There is someone. Can you hear me? Was the system corrected? Are we okay now? 1, 2, 1, 2. When you're ready, I can begin to speak in English. And then we will switch channels to see whether the other channels are working properly. 1, 2, 1. Black, white, green, red.
Uno, y tres. No, la presentadora y sí, está bien. Sí, está bien. Sí, sí.
1, 2, 3. Estamos en el canal inglés en este momento. We are in the English channel. 1, 2, 3. That I have never seen. Fact unless I'll never see it. I was going up a man who was. Everywhere he takes. Yes.
Sí, ya espérame que
Yes.
estoy mirando el ruido del inglés.
Just 1 second. We're
Okay,
looking
so this is
at,
for testing
that we
purpose
have
of
it.
English channel.
Esto es con propósito del canal español. Veamos si yo puedo escucharme tanto en inglés como en español. Esto es una prueba de inglés, entonces, para verificar si se puede hablar en español. Este viene siendo el canal de traducción de español. Estamos verificando ya si hay un ruido adicional o si el limpio queda limpio. Si el sonido está limpio. Claro, como el cristal. Este es el canal español. Estoy hablando como si estuviera escuchando a alguien hablando en inglés y luego yo traduciendo al español. 1, 2, 3, esto es el canal español. Oh, qué misterio espantoso es este de la existencia. ¿Por qué viene yo a nacer? ¿Quién dio esa ley enemiga de ser para padecer? Nada estaba yo. Nada a execrar la hora menguada en que mi vida empezó. Y una vez que se cumplió ese prodigio funesto, porque él mismo que lo ha impuesto de él no me viene a librar, he de tener que cargar un bien contra el cual protesto. Alma, si vienes del cielo, que ya viviste otra vida, si eres imagen cumplida del soberano modelo, ¿cómo has perdido en el suelo la fe de tu original? ¿Cómo en tu lengua inmortal no explicas al hombre rudo ese fatídico nudo entre un dios y un animal? O si es que antes no exististe y al abrir el mundo al sol, tú, divino girasol, gemela del polvo, fuiste. ¿Qué crimen obrar pudiste? Do contra quién, cómo y cuándo, que estuviste a Dios clamando y a donde vaya en que estás, surgiste tú nada más que para expiarlo llorando. ¿Quién te hizo Dios? ¿Por qué di? ¿Cómo, dónde y cuándo vino privilegio tan leolino a corresponderte a ti? ¿Por qué no me tocó a mí ese poder de poderes? Siendo yo lo que tú eres, no fuera el mundo cual es, o aplastara con mis pies tan triste enjambre de seres. Un momento, un momento. Okay, disculpen. This is the English channel. We're testing then to see whether the sound is clearing okay. We're testing the system. We would like to verify whether the global school, the fifth global school in migration, we're testing the system. Please confirm whether the system is working. 1, 2, 3. Good. So it seems to be working. We hear it clear. I seems to be hearing this clear. We're hearing it okay. Do you hear any issues in sound, or is it okay? Can you hear any noise, please? Please confirm whether you can hear any noise, any interruptions in the sound. Please confirm whether the sound is clear. We can hear it. It's working. It's working. We can hear the sound. We can hear the voice okay. We can hear. Can you please confirm whether you can hear my voice? And now Chetin is going to connect in the Zoom channel to verify whether we can hear it in the Zoom. And then we can change language to see whether the change works. Let's change now. Let's see if it's going to change further on. Can you please let me know when we can change language?
¿Podemos cambiar de idioma? Ok, yo voy a empezar hablando en inglés ahora, entonces. Hello, good morning all. How are you today? I hope you are having a great day. And we are going to start the 5 global school today. Today is a great day. Today is a great day. Thanks to all for all your support. Please confirm you can hear my English well. Can you hear me well? Can you hear me my English? No noises in the middle, no echoes. You? Okay. Chatin, are you connected in Zoom? Okay. Go ahead, enter. The floor is yours. Sí, sí. Chatin is talking in a yes. No. Can you do it again, please? He's talking in a Zoom. Are you talking in a Zoom, right? No, I know. Yeah, enter in the Zoom. Okay. Is Chatin connected? Oh, you have your mic closed. You have your mic closed. Are you happy? Oh. You can keep talking, please, a little bit. Yeah, speak.
Bien, entonces esta es la tercera prueba de español, me disculpo.
And the purpose of this test is if I'm audible in English channel in English, and if I'm audible in Spanish channel in Spanish. Because I cannot speak Spanish, that would be a huge success for me if I'm understandable in Spanish. Over.
Okay, good. All good? ¿Todo bien?
Sí, que diga si está bien.
Good?
English is okay.
It's okay.
Spanish?
Spanish.
The English is muy bajito volumen, lo escuché el ambiente.
But it's because
So should I start now? Okay, I'm repeating my pleasure to have another round of test on Zoom for the purpose of checking if I'm audible on English and Spanish channel. I'm speaking on an open ground with a high dome, and that may be the reason why there's a lot of ambient and echo in the background.
Sonido, ¿sí? Sonido, ¿sí? Sonido, ¿sí? Sonido, sí.
Buenos días, estamos a punto de comenzar. Voy a hacer unos anuncios en español antes de empezar. Muchísimas gracias por estar de nuevo con nosotros. Como ustedes saben, hoy es nuestro último día de escuela. Hoy vamos a tener unos cambios que los voy a explicar más adelantito.
In them a little bit further on. We are going to have a part in Spanish, a little bit more ample at the beginning of the event. Thank you. Yes, thank you for the silence. Thank you. It's important to please take your phones in silenced so that there's no issue interrupting the conversation. Today we're going to have a part in Spanish. I'm going to do the introduction usually as I've usually done it in English, and then we're going to move to Spanish somewhat. And today it'll be a little bit different because we're not going to have videos of the country, but we're going to have a much more ample round table with individuals that are privileged to have because they are people that are in the front lines of emergencies in various parts of the world. So as you might understand, all these are individuals that are facing crisis at all times, and they have taken some time to be here, must be considered a privilege. As soon as I receive a signal, I will begin the transmission for those that are following us. Today it's going to be a little bit difficult to remind you at the end to fill out your form because we're going to say goodbye and such. So even if we do not place the QR code for you to scan it, everyone that is registered are going to have access to be able to fill out this form. Please do not forget to do so because as soon as you do, that's going to activate the participation certificate, and if you don't, it will not be activated. Therefore, it's important for you to do so. Okay, I have here now the signal. We are now online. About to begin.
Hello, everybody. We are on the final day of our school, the 5th edition of the World Health Organization Global School for Migrant and Refugee Health. And the feeling is this combination of happiness with sadness, you know, because, of course, happiness because it's been a success. Thanks to you, to your participation, as I told you yesterday, and sadness because we are not gonna see each other for a while. But let's leave the emotions for the end of the session. For now, let's go directly to the point of today. The topic of today is addressing the health needs for refugees and migrants during and beyond emergency crisis. It means we will learn about practices to attend the needs of migrants and refugees in terms of health, not only when the crisis is ongoing, but also before and after. So it will be very interesting. And to develop this topic, we are going to have slightly differences in the structure of the event. Today, we will not have video reportages from countries. We already had 7, very powerful, as you know it. And because we are going to use more time with a round table discussion, and it will be very important because we will have as a panelist experts who are on the front lines in different countries attending emergencies with migrants and refugees. So it is a privilege to have them with us, and we want to have as much time as possible with them. The other difference is on the form, you are gonna see another section. This is for you to evaluate the overall event. Remember to scan the QR code. If we cannot show this at the end of the event, if you are registered, you know how to access to the form. And don't forget to fill it out because that's the way you unlock your certificate of participation. And as Dr. Severoni told us yesterday, we are willing to receive your critics also. It's very important for us that you let us know if you send us a critic, why. That way we can really improve during the next edition of the school. And we will have another difference today, a main one, which is we're going to start with a different co-facilitator. Don't worry, Dr. Severoni will be here later too. But today we are going to start with an esteemed leader in the field of public health, emergencies, and resilience. He is the unit chief of public health emergencies at Pan American Health Organization, Dr. Celso Bambarem. I'm gonna talk to him in Spanish, as we both are from the same region. So I will let you have like 10 seconds to switch the language on your equipments to facilitate the understanding of our conversation. So, Dr. Celso Bambarem, por favor, acompáñeme acá en el...
Be with us in this scenario. Let's receive him with an applause, please. Thank you so very much. We need a microphone for Dr. Celso, please. If you please hand me a microphone. Thank you so very much. So welcome. It is a pleasure to have you in the school and in Colombia. Let's take a seat. Thank you. And well, in today's topic, I believe it's very important because obviously you have to tend to crisis, but to be able to better tend crisis, you have to be prepared for crisis and to know that what is upcoming after the crisis is also quite challenging. First of all, good day to all of you. It's been a pleasure to share this conversation with you, with this important panel that focuses on the topics of crisis. It's a very important topic in this region. It's a topic in which you get a lot of events of public health in the preparedness for emergency and all types of emergencies and response. Obviously, to respond to migratory crisis, our directorate has worked very closely with the ministries of health of various countries to reinforce capabilities and to be able to face the various migratory crises that we have in the region. This is a very special space to find those points of intersection that we have amongst the work of emergency and what is beyond the emergency, to include the migrant, the refugee, as part of the national systems of health and the systems of health insurance. So we're going to have an introductory message that we've had every day. This time the message comes from the Dr. Ailan Lee. She is an assistant of the National Directorate for Universal Coverage in Healthcare and for healthier populations of the of the World Health Organization, and it's very important progress that has been made in universal coverage in healthcare, and we're going to speak today about how emergency response is going to impact universal healthcare coverage. So let's hear to this message, which is in English. If you need to make change to Spanish, please do it now, because el mensaje está en español, como he dicho.
Dear colleagues and friends, it is a great pleasure to join you for the 5th Global School on Refugee and Migrant Health. Today, 1 in every 8 people are on the move. The challenges are huge for our health systems and societies. But we also have the great opportunities. This year, we focus on advancing universal health coverage for refugees and migrants. This action is a key for healthier populations and greater health equity. In this regard, I would like to share 3 key reflections. First, we must intensify our effort to ensure refugees and migrants access health services they need. This group face significant barriers to quality health care, especially during crises. Access to health services must be ensured for all people without discrimination. We need to remove barriers, ensuring that no one is left behind. Second, we must work together to make health systems sustainable, inclusive, and resilient. Strong health systems are essential for providing health services, not only in the times of crisis, but over long term. This means integrating the health needs of refugees and migrants into national and global health policies and programs. Third, equity is the core of our action to promote, provide, and protect health for all people. In a world marked by interconnected and overlapping crises, social and health inequity continue to grow. In line with WHO's new Global Health Agenda for 2025 and 2028, every effort is needed to prevent, reduce, and close health inequities. I encourage you to be leaders to advancing equitable and inclusive health systems. Together, we can co-create a safer, healthier, more equitable, and more sustainable future for everyone. There will be no healthier populations without the health of migrants and the refugees. Thank you.
It's important to understand it. Some that has no delays. When a person is in a migratory situation, it's already in a sense of emergency. But then when you add the issues in healthcare and lack of access to healthcare, this would indicate then that you have to act taking into account that sense of emergency. Yes, very important, these messages that we've heard now. Specifically, these emergencies have to do with ensuring access to true access to healthcare in the similar conditions, both for the migrant and for the people that have received the migrant. And it has to do with the topic of emergencies, specifically the emergencies, acute emergencies that the migrants have suffered in various countries, and also the problems that they're going to have due to the weakness associated to factors that are very structural in nutrition, instruction, education in their countries of origins, and obviously requires attention during their permanence in the country. And the second point, which is also extremely important, is that we have to not just ensure inclusion of the migrants that are refugees, but also reinforce the system for the entire population, because it's an attempt to have a greater coverage, and also very important what has been reported, the topic of resiliency for the healthcare systems, that it has to go beyond any type of emergency. I believe that COVID left us some very important learned lessons, very important for the resiliency of the healthcare systems, not just emergency, but for any type of situation. Before we hear the message of Dr. Ciro Duarte that you're going to bring us, I have a question when I hear you. That is that a person in migration can leave their country entirely healthy, but the probability of developing some type of mental or physical illness, how high can it be? Because they are in a migrating situation, they are going to face less care, higher risks. Do you know the percentage of probability? It's quite high, actually. I estimate, according to statistics, the people that go through that DN, more than 50 to 80% have some type of acute issues. We're speaking about classical issues such as lesions due to the movement, gastrointestinal disease, dehydration, and a very important topic, and I'd like to topic, and that is gender violence. Is a topic that is present, specifically the walkers amongst various countries. This is a great topic because women are also exposed to sexual abuse. There are women that are in gestation and do not have that We have the message of Ciro Duarte. We're going to now listen to the message of Dr. Duarte. He's the director of the emergency department in the Ministry of Health. He has ample experience, quickness response, specifically in the region of the Americas, including the responses based on the various migratory.
Muy buenos días, muy buenas tardes, muy buenas noches. Y vamos a hablar en relación con la cobertura de salud universal a través y más allá de las crisis de salud de los migrantes. Quisiera recordar que en la región de las Américas los ministros de salud adoptaron 5 líneas estratégicas, casualmente para proteger la salud de los migrantes y de las poblaciones de acogida. La primera línea de acción está vinculada a mejorar el acceso a la salud de las poblaciones migrantes y de las poblaciones de acogida. La segunda línea de acción está en mejorar los sistemas de vigilancia de salud para poder detectar a tiempo los problemas que los migrantes y las poblaciones de acogida presentan durante el tránsito de la población migrante o su permanencia en los lugares de acogida. La tercera prioridad está vinculada con mejorar la comunicación de riesgo y mejorar la comunicación pública para reducir la xenofobia y la discriminación a la población migrante. La quinta línea de acción está vinculada al fortalecer las alianzas entre instituciones, entre países, e incorporando a las organizaciones de los migrantes en el proceso de identificación de los retos y de la solución de los problemas. Y la quinta línea de acción es la de adoptar y aprobar nuevos mecanismos legales y mecanismos de acceso de los migrantes a los servicios de salud, de tal manera que pueda ser en un sentido un poco más amplio. Quisiera recordar que hay acciones generales que se adoptaron en los países y hay algunos datos del marco de acceso de los migrantes a los servicios de salud. Por ejemplo, Brasil provee el 100% de acceso a través del Sistema Único de la Salud. Chile provee el 74% de acceso a la seguridad en salud o al seguro de salud. Colombia tiene el 55% de las personas registradas están afiliadas a la seguridad de salud y el 17% están afiliados en el caso de Perú. Existen riesgos para los migrantes y esos riesgos están vinculados a las enfermedades transmisibles, a las enfermedades no transmisibles y personas con discapacidad, a la salud mental y a los daños y violencia. Quisiera mencionar que hay datos de los países que refieren un incremento en los riesgos de enfermedades infecciosas, aquellas que traen los migrantes, pero también aquellas que prevalecen en los lugares de tránsito y de destino y que afectan tanto a la población migrante como la de acogida. En el componente de enfermedades no transmisibles vamos a relatar algunos puntos prioritarios luego, igual en salud mental y en la violencia. Respecto a enfermedades transmisibles, los problemas vinculados a enfermedades respiratorias y gastrointestinales tienen una prevalencia y aquí tenemos algunos ejemplos de países cuando tienen un registro específico. México, por ejemplo, el 47% de las personas que han sido encuestadas reportan problemas respiratorios, 9% reportan problemas gastrointestinales y estos son datos de la Secretaría de Gobernación y en la Dirección de Migración y Salud del año 2022. Respecto al HIV-Sida, en el caso de Perú, el 17% de los migrantes venezolanos tienen acceso a las pruebas de diagnóstico y en Colombia el 33.000 casos con atención médica para HIV-Sida entre el año 2017 y el año 2024. En el caso de enfermedades transmitidas por vectores, también tenemos datos sobre miles de casos de malaria entre ese mismo periodo y 2.820 casos de dengue desde 2019 al 2023. Tenemos datos relacionados a enfermedades no transmisibles y personas con discapacidad. Y ahí tienen los datos de Perú, por ejemplo, en relación a las enfermedades no transmisibles, con prevalencia de casos de asma y de hipertensión. En el caso de Colombia, el 30% de los migrantes reportan que tienen diabetes, y en el caso de áreas de tratamiento, el 68% de pacientes con enfermedades no transmisibles no recibirían tratamiento. Esta es una encuesta oficial del gobierno de Perú. Respecto a la salud mental, existen causas prevalentes, particularmente los retos relacionados al aislamiento, a aspectos económicos y miedo a la deportación. Y además hay espacios adicionales para las poblaciones LGBTQI+, que sufren una discriminación adicional a su condición de migrante. Existen problemas como el estrés y la depresión que afecta a casi todos los migrantes y refugiados. Y respecto a la demanda, reportan, por ejemplo, a las organizaciones internacionales un incremento de la demanda por servicios de salud mental que está creciendo. Existen consultas de emergencia, y quiero enfocar en el paso del Darién, que es la zona entre Colombia y Panamá, donde la mayor razón de consulta son problemas de salud oral y seguidas por los riesgos durante el embarazo, diabetes e hipertensión. En el caso de Panamá, las mayores razones de consulta están relacionadas con trauma, probablemente debido a las condiciones del tránsito, infecciones en la piel, gastroenteritis y problemas de rinofaringitis. Los migrantes son afectados por emergencias y desastres desde muchísimos años. Están relacionados con las muertes durante el tránsito, y vemos que los datos de muertes durante el tránsito solo en este año, entre enero y septiembre, superan los 497 casos que murieron o fueron desaparecidos, y 291 muertos o desaparecidos durante el tránsito marítimo, particularmente a través del Caribe. Muertes relacionadas con el calor, particularmente en México, donde se han reportado 155 muertes relacionadas al exceso de calor entre marzo y septiembre de este año, y las inundaciones en Brasil, donde 43.000 refugiados y migrantes, principalmente venezolanos y haitianos, fueron afectados por las inundaciones en el sur de Brasil. Hay un impacto de los desastres en los patrones de migración. Y claramente esos impactos están relacionados con la violencia, por supuesto también con conflictos, con los aspectos económicos y políticos, con la inestabilidad del cambio climático y la disrupción de los servicios de salud y otros eventos. Tenemos que tomar en cuenta que las acciones de emergencia están vinculadas al acceso a los servicios de salud, al control y vigilancia de las enfermedades transmisibles, particularmente, a la vacunación y otras intervenciones de salud, y al soporte en salud mental y psicológico. Aspectos relacionados con la vinculación al desplazamiento por desastres están Brasil, Colombia, Cuba, Haití, con esas cifras que ustedes pueden ver, 708.000, 281.000, 90.000 y 106.000 respectivamente. Hay retos vinculados también a cómo podemos enfrentar los retos sobre información, los sistemas de información, la inclusión en los planes nacionales y las iniciativas a través de las fronteras. Las necesidades de mejorar la información y la vigilancia son fundamentales. Hay países que tienen un avance fundamental, ustedes lo van a ver o lo han visto en la presentación de Colombia, y en el caso de la inclusión en los planes nacionales, lo que se busca es que ese acceso sea formalizado y de tal manera que pueda tener también recursos suficientes para brindar salud a los migrantes y la población desplazada, inmigrante en los países. Y la implementación y coordinación de intervenciones a través de las fronteras, porque en esos lugares y pasos fronterizos legales y no legales existe una incorporación de procesos que los países están avanzando. Todos estos retos están siendo desarrollados en los países y debido a eso, los países de las Américas han decidido que va a haber una estrategia regional de migración y salud que empezará el próximo año y que durará durante todo el periodo del plan estratégico de la OPS, desde el año 26 al 31, y en ese plan estratégico se profundizan en las líneas establecidas por los ministros, añadiendo otros aspectos vinculados a la experiencia propia de los países. Yo creo que trabajando juntos en los países de las Américas, con el apoyo del nivel global, pero también con la intervención de instituciones públicas, privadas, de la sociedad civil y los organismos internacionales, y principalmente con la acción activa de los migrantes, podremos ir superando los retos que enfrentamos día a día. Trabajemos juntos, es una responsabilidad compartida. Muchas gracias.
An applause for the message of Dr. Ugarde. By listening to Dr. Ugarde in this last part, when they were speaking about the strategic part that begins next year, goes from the 26th to the 31st. We have to tend to the healthcare needs of migrants and refugees, not just at a time of crisis, but maybe more in a long term. And I don't know whether I'm mistaken in this, but I would like for you to correct me or maybe to explain it to us. The fact that we have a attention plan for all these years, more than 5 years, it would mean precisely that, because even if only a single person does not migrate, it will be such a large number of migrants in the Americans that you have to plan it on the long term, beyond just the migrating purpose. I think that it should be understood as a human phenomenon, because since we are human, we've migrated. Many of those that are here are labor migrants or migrant for various reasons. Therefore, migrants are part of the population that needs to be serviced together with the population that remains in the country. The plan goes beyond, because the situation is always going to be present. It's been more visible in the last few years, probably due to some situations that have occurred in the region, but the situation will always continue. It's been there for many years. The region of the Americas now don't have an internal cycle amongst countries. They also have external migratory flows, people that come from Africa, countries from Asia, and that cross all the continents towards the north to look for a new life opportunity. And within the framework of work, that's where Dr. Laios Barbosa, our director of the Pan American Health Organization, has taken some time to discuss amongst countries, to discuss amongst governments, the migration strategy based in law in 2018, and takes as reference very important agreements that have been held at a global level. The Declaration of Rabat last year, for example, very important events to be considered. The same action plan of the World Health Organization that has been extended to 2030, and very important elements. And based on that, what we've done is the update of this guidance, including topics that should not be left aside. For example, the academic issues, the research. Research is very important so that people in the countries don't just research to research, because it helps us to improve, intends to improve the interventions and the design of interventions, and to bring conclusions into what could be more effective for migrants. I believe this is one of the most important conclusions of this edition of the school, which is how we are going to require various sectors involved, but very well coordinated, so as that everything be relevant, to have more timely responses, to have more creative ideas for financing. It cannot be a single sector that is in charge of this, but it needs to be a sector with a multi-vision, multi-sectoriality. Something that calls very much my attention to the message that was provided by Dr. Ugarte, because it's been here in these last 5 days. That is the significance of mental health. The world, for some time back, has placed this topic as something that is very significant But when it has to do with crises like the ones that are faced by migrants, perhaps that is left in the last place, and it turns out that tending to the mental health of migrants should be tended to because they can better integrate to their destination and to achieve what they want to achieve when they migrated. That was their purpose. There's a lot of challenges, and I wish you would speak to us from your experience of how you see that these challenges should be faced. Mental health and psychosocial support are topics that are very visible in migratory crisis. All the organizations that work on the top, we have reviewed it and we have addressed it. We've placed it on the table. And people suffer various types of issues. We always have to place in evidence one-to-one that migrants are migrant between countries and you have to be settled within the community. And it's not just topics with need of pressure, such as Dr. Olarte, but also topics that have to do with violence. And I'm going to highlight here because violence when you are a migrant during migrating and passage between countries is violence based on gender. That discrimination that the migrant has suffered, and all the topics that impact mental health and that most effectively have limited their true performance in the country within. Thank you so very much for this consideration that you've shared with us. Online, we have the moderator of today's panel. He is with us from Egypt. He's Dr. Ali Ardalan, who is the regional advisor and director of the healthcare system of the Unit of Resiliency in Healthcare of the World Health Organization for the regional office in the Mediterranean. I don't know whether it translated well because the name is very long, but Dr. Ardalan, hello. How are you? Can you hear me? El doctor Ardalan está en vivo de Cairo. Veamos si podemos escucharlo y él puede escucharnos a nosotros también, doctor Ardalan. Verificando. Let's speak a little bit more just to verify. Just to wait until Dr. Ardalan is with us. This is going to be a very interesting panel because we have the individuals that are servicing the crisis for migrants in various countries. It's not just a privilege because there's people that have taken time amid a crisis situation to be with us. And they are the ones that are first-hand witnesses to what is happening, the same as you, right? That is your work. And I would like now more from the personal side ask you. We're all going to live here with some learning points in these 5 days, and then we are going to have the December holidays, and we're going to forget what this means and how to be able to apply it on the day-to-day to our work, to our lives. I'd like to ask you from your personal perspective a message towards this reality. As I said, we need to understand that migration, it's important to see in the migration something that contributes to a country. Most definitely, the benefit that migration can bring to a country is extremely important and interesting. And this is also a topic for reflection. The second point is that the migrant that is incorporated into the healthcare system is the only way to have them to have these complications. Well, thank you so very much. I am going to remain with that phrase, not consider migration an issue, but as a solution in many things that we've not achieved in our own countries. We now have Dr. Ardalan. Dr. Ardalan, can you hear us? Sí, yo puedo escucharlo bien. Let's see. Dr. Ardalan. Sí, yo puedo escucharlo. ¿Cómo le va? Es un placer tenerlo usted aquí. Muchas gracias, es mi placer. Usted es del Cairo, ¿cierto? Sí, es correcto, estoy en el Cairo. Permítame decirle que nosotros tenemos una audiencia de
100 people right now. And here in Bogota, we are about, let me see, like 100 people listening at you. So we are ready to hear you. I'm going to be here in case I can help in anything, but the floor is yours to start the panel discussion.
Thank you so much for the opportunity. It's great to see all this actually high interest to the school. Let me to start with extending a warm greeting from Cairo to everyone in the room here in Bogota and to those joining us online from across the globe. So good morning, good afternoon, or good evening, depending on your time zone. Migrant health emergencies and forced displacement caused by conflict, climate change, and economic hardship pose immense challenges to health systems worldwide. Today's panel will focus on aligning emergency response with long-term health system strengthening to advance universal health coverage for refugees and migrants. Our distinguished panelists bring a wealth of experience and insight to this important discussion, representing diverse perspectives from Colombia, Qatar, and the Philippines, as well as the key UN agencies such as WHO, IOM, and the UNHCR. I'm sure they will provide a comprehensive view of strategies for addressing the health of migrants and refugees during emergencies, as well as the related challenges faced in the field. I would like to remind all speakers to adhere to their allotted time of 5 minutes to ensure we hear from everyone and have ample time for audience engagement. And thank you so much for your cooperation in advance. Our first panelist is Dr. Kenneth Ronquillo, Undersecretary of Health for the Philippines. Due to time zone difference, he has kindly prepared a video message for us. In this video, 5-minute video, Dr. Ronquillo will discuss the Philippines' strategies for managing health emergencies affecting the migrant workers abroad. Let's watch the video.
Thank you, Dr. Ali Ardalan. To our colleagues in the health sector, international and non-governmental organizations, and other stakeholders contributing to refugee and migrant health, warm greetings from the Philippines. We extend our appreciation to the World Health Organization Department of Health and Immigration for organizing the 5th Global School on Refugee and Migrant Health and for providing the Philippines the opportunity to share its experience in addressing health emergencies affecting our overseas labor force. The Philippines is globally recognized as a major sending country of migrant workers, with over 10 million Filipinos living and working abroad. These constitutes about 10% of the country's total population. In 2023 alone, an estimated 2.33 million overseas Filipino workers left the country to pursue opportunities abroad. Migration and health are deeply interconnected. Migrants face unique challenges in accessing health care, especially during emergencies like natural disasters, conflicts, and health crises. These challenges are compounded by barriers such as cultural differences, legal status, and health system capacities of host countries. Recognizing these vulnerabilities, the Philippine government has institutionalized policies and action plans to safeguard the health and well-being of Filipino migrants. As a testament to this commitment, the Philippines is among the early adopters of the Global Compact for Safe, Orderly, and Regular Migration. Furthermore, hallmark legislations such as Republic Act 11641, establishing the Department of Migrant Workers, and the Migrant Workers and Overseas Filipinos Act have cemented the country's frameworks for migration governance, including health protection. The COVID-19 pandemic was a stark reminder of the importance of such systems, In 2020 alone, over 327,000 overseas Filipino workers were repatriated, with many requiring medical support and quarantine. This exposed critical gaps in coordination, health resource allocation, and mental health services for migrants. However, it also served as a catalyst for reforms, such as strengthening the interagency collaboration between the Department of Foreign Affairs, the Department of Migrant Workers, and the Department of Health to better address future emergencies. In times of natural disasters, conflicts, or health emergencies, the Philippine government employs a whole-of-government, whole-of-society approach to ensure the safety and well-being of affected Filipino migrants. Key initiatives include maintaining a comprehensive crisis alert system that categorizes threat levels for Filipinos abroad. These guides deployment restrictions, evacuation plans, and health advisories in accordance with established international relations protocol. Providing immediate repatriation assistance to Filipinos in distress to the One Repatriation Command Center. These include coordinating transport, shelter, basic and medical needs, and reintegration upon return. Facilitating repatriation for critical health cases requiring special medical care, from pre-departure, travel, to post-arrival through the Interagency Medical Repatriation Assistance Program, and assisting repatriated OFWs who face financial challenges in addressing their healthcare needs through the Department of Health's medical assistance to indigent and financially incapacitated patients program. Highlighting a recent experience from conflict in the Middle East, the Department of Health deploys medical teams including psychiatrists, pediatricians, and general practitioners to conduct initial physical and mental health assessments for mass repatriates upon their arrival at the Philippine airport. The Department of Health National Patient and Navigation and Referral Center has a 24/7 referral center that provides patient navigation and referral services for health-related transactions. Coordination and referral to hospitals, including medical transport, will be facilitated as needed. Admission to hospitals are prioritized through the dedicated OFW wards in our government hospitals, and we ensure that medical financial aid is distributed through the approach channels, malasakit centers. While the systems have shown resilience, we acknowledge areas for improvement, particularly in scaling up our mental health services, ensuring seamless interagency coordination, and expanding bilateral health agreements with host countries to guarantee the protection of migrant workers. The Philippines remains steadfast in its commitment to safeguard its citizens wherever they may be, promoting access to healthcare services, especially during times of crisis. Thank you.
Dr. Ardalan, are you there? Are you still there?
Yes.
Okay.
Yes. And thanks for the video, and thanks to Dr. Ruincoilo for his insights. The Philippines' comprehensive cross-border strategies actually provide critical examples of how to address the health needs of migrants affected by emergencies. Next, joining us remotely is Dr. Soha Shawqi Al-Bayat, Director of Health Emergency at Qatar Ministry of Health. Dr. Al-Bayat has played a critical role in Qatar's response to large-scale labor migration and health emergencies, especially during COVID-19 pandemic. Dr. Al-Bayat, can you hear me?
Yes, hello.
Hi.
Good afternoon or good evening, depending where people are.
Yes. So, good afternoon to you. Dr. Al-Bayat, could you elaborate on Qatar's strategies for safeguarding migrant health during crisis?
Yes, certainly. First of all, I apologize. I'm having a technical issue. I can't open my camera. but I hope you can hear me clearly.
No problem, no problem. I can hear you very well. I check with Claudia and colleagues in the room in Bogota.
Yes.
Can you hear?
Yes, we can
Okay.
hear her very well too.
That's great. That's
Thank
great. So,
First, thank you for the opportunity to share Qatar's experience on how to take care of our migrant workers. Many countries, Qatar is not different from countries in the region where a lot of our workforce is comprised of immigrant single male workers. And I'll take you back to 2010 when we were awarded the privilege of hosting the FIFA World Cup. This had led to the migrant workers population to really increase, and it really became doubled and tripled the normal numbers prior to that. And they were working in various sectors, including construction, hospitality, and domestic services. They come from few of the lowest income countries, and they made up for a large number of the workers in the country. The government of Qatar provided adequate and world-class healthcare for everybody, which included the migrant workers, and it was absolutely free of charge, with the except of a few services that were optional, and even those were at a nominal fee, not the full fee. And then COVID hit, like the rest of the world, and we had to take care of the entire population. So all measures to prevent or contain the COVID-19 virus ensure that all people have access to health care, including preventative care, treatment for everyone affected without any discrimination. There were dedicated public health centers for those single male workers run by the Qatar Red Crescent. Also, in certain areas, hospitals were designated just for them, so they have easy accessibility in their area. So what happened is that in March 2010, we had one case in the beginning. Then we suddenly had an outbreak, and they were all single male workers working in an area called the industrial area in the state of Qatar, and mostly people living there or working there happened to be the migrant single male workers. So to ensure that, or try an attempt to avoid or delay the spread, a decision was made to kind of, block this area and to make sure that it doesn't spread. So it was closed up area. But at the same time, we needed to make sure that whatever needs for these people is made available. So the health centers expanded, and we made sure they're closer so they can have access to medical care. The hospital that was designated for them meant they had to leave that area. So a new hospital was set up with all possible needs made available for them in that locations. We ensured there are supermarkets available for them. Anybody who got COVID-19 was given paid sick leave. Those under contacts of a close or close contacts of a case, since they had to be quarantined, we made sure that that does not get any deduction from their pay scale. The government made sure that the employees or the employers paid full wages. They made sure that they had 3 full meals, snacks, any needs were catered for. Even some recreational facilities was made, so they don't really feel like they're blocked. So we made sure that everything they needed was made available. At the same time, what we noted is because these people come from countries and to get the visas and to be able to come, they had made huge loans back home, and then they had to pay back. And that's why we made sure that they don't suffer from any pay cuts, which may lead to, some adverse issues to them or even their families back home. So we also made sure that they're well taken care of physically and even their mental health. So mental health support was also provided for them. And we made sure so everything was covered. Other than that, because they come from low educational levels, and we wanted to raise awareness, have some community engagement, so teams from the public health went down to those areas that spoke several languages to help in raising awareness and give them the necessary education. We had leaflets in various languages just to make sure that they can also take care of themselves, because not all the time they needed actual medical care. Even when the vaccination started, we had a huge unit just made for them close to their area to ensure accessibility, to ensure equitable services. And they were given the best vaccines, just like the rest of the community, at their convenience, at their location. So it didn't cost them to pay for taxis or whatever to go to the vaccination center. We brought it really close to them. And mind that their wages are low anyway, so we didn't want them to waste their money.
Thank you so much, Dr. Al-Bayat. Thank you so much. Actually, we all know how challenging is that managing a pandemic, and actually with the large proportion of the labor migrants you have in Qatar. You also have the experience of the FIFA, and that was also unique. And if I may, I want to ask you just in 1 minute, what lessons learned you want to highlight that are applicable to other countries as well? In 1 minute, please. Thank you.
First of all, we need to always take into consideration education levels, language skills, needs like anybody else. The fact that they're single male workers does not make their needs any less. And that's a lesson learned. We learned from COVID and from the FIFA World Cup. And we're continuing it now. We're actually expanding it. We're making sure that whatever such category of workers needs is there. And this will teach us in future, God forbid, we know it's always about when, not if, future emergencies. We've learned and we're ready for it, inshallah.
Inshallah. And thank you so much. And I think that your success is the reflection of the robust policies and actually implementation by Qatar. Hope you will be able to stay with us for the rest of the panel online.
Yes, thank you.
Now, I want to invite Dr. Mayra Alejandro Nieto Guevara, connecting online. Can you hear us, Dr. Alejandro?
Así es, puedo escucharlos. ¿Ustedes me escuchan bien?
Yes, I can hear you, and thank you so much. So, Dr. Guevara has been at the forefront of Colombia's response to the Venezuelan migrant crisis, focusing on balancing emergency health interventions with sustainable integration into national systems. And this is my question to you, Dr. Guevara. How has Colombia addressed the health needs of Venezuelan migrants during the ongoing crisis? And what strategies have been effective and what lessons can be applied elsewhere? You have the floor.
Well, thank you so very much. Good day to all the attendees, those that are both in attendance and virtually. We are going to bring messages of the minister. She expressed on Monday during the school. The country is very honored to have this 5th global school. I'm going to make an efficient usage time so that we can express the learned lessons or the strategies that the country brought forth to be able to tend to the migrant population. In this sense, it is important to keep in mind that Colombia assumed a double role in this migratory role. We were a transit country that wanted to go to other destinations. It could be towards South America or towards the north of the continent, and also as a main receptor of the Venezuelan migration that decided to remain permanently in our country. According to the figures of Migration Colombia, the population of Venezuelan nationals intensified between 2014 and 2023, reaching a very significant figure in 2023 of 2,875,000 individuals. That's the population on the national territory. And Colombia has expressed or has lived a very important flow from other nationalities, specifically in the cordon of the Pacific, in transit towards north of the continent, where we can highlight citizens from Ecuador, from Haiti, from China, also from India, from Bangladesh, from Chile, Afghanistan, and Peru, amongst other nationalities that have the figures significantly, statistically significant in the populations. We focus mostly on human rights, allowing with this to approach the response with social determinants in health, and this allowed to be able to design the plans, the programs, and the policies that the country was going to bring in an intersectoral way, also that we can give an appropriate response to the crisis under this context. The first lesson that the country learned was to regulate the migrant population, and was also expressed, and most assuredly throughout the school. The country brought forth various institutional mechanisms. Amongst them was the institution of the National Statute of Protection that introduced temporary protections for Venezuelan migrants, and this allowed them access to fundamental services, amongst them, and first of all, healthcare. That was also considered. Another learned lesson that we had as a country was that the response could not be sectorial. It requires intersectorial coordination, and obviously supported with other actors, with international cooperation. In this sense, the evolution of this temporary protection had an evolution which was very significant. And in 2021, it got to maybe to 2.1 million migrants that were able to be formalized. And with this, they were included effectively in the labor market, in education, and in healthcare services. In addition to this, the country, and as of this regularization and the sectorial coordination, brought forth two important actions: the inclusion of the migrant population to the general system of social security and health through this regularity, and to have that document and to typify and to give regularity to the population. In this sense, based on our database for enrollment for September 2024, the country has 1.5 million Venezuelan migrants enrolled in the general social security and healthcare. Close to this, close to 500,000 are affiliated to the contributed regimen. That is to say that the pay for this healthcare service, and 1.25 million people belong to the subsidized regimen. This population that is enrolled in the healthcare system is an important challenge for the system, mostly to that fiscal pressure to be able to provide a service to the entire population. We can say that the system was asphyxiated, so to speak, in tending to all the needs of the population, because as the minister expressed on Monday, the country and the healthcare system ensured and is still ensuring the emergency service for the population that is not regular, is not formalized. And obviously, it is tending to the population that is already enrolled in the healthcare system. Nevertheless, despite these efforts that the country has done, in particularly the ministry, to ensure the fundamental right to health, there are still important challenges to be able to ensure. Me disculpas, Dr. Bengara.
Kindly actually give examples of the lessons learned that can be applied to other settings. I do appreciate.
Desde luego. Bueno, una lección aprendida que consideramos muy importante.
A learned lesson that we consider that was very important is to be able to formalize and identify the population, so that in our case we can see the general healthcare system to be able to service and not to asphyxiate the system financially. Other actions that we're bringing forward and that can be useful of successful cases is that we're bringing forward the healthcare for the migrant refugee returning populations nationally and territorially, taking into account the transit of this population through our country. We are also drafting the strategy of psychosocial accompaniment for the migrants, refugees, and returning populations, because we understand the various fronts, not just the migrants, but also those that are returning to our country of our nationalities, and the communities that are also bringing them in this plan for permanence. Similarly, the ministries, through the current strategies of Colombia, of powerhouse of life, we're investing a great amount of resources for basic equipment in healthcare to allows us to tend to the population both in Colombia and migrant, and this way to ensure right to healthcare. Lastly, I'd like to repeat as a learned lesson that it is also important to be able to replicate in other countries coordination, both from the various sectors, education, the migratory policy, but all this has to be coordinated with international cooperation. For us, it's a great relief as a country to receive the support of the OIM, Abdur, USAID, the coordination they have with the healthcare cluster that has several agencies in the response that we know that as an entity we could not offer, and the international cooperation was there to offer that support. Thank you very much.
We were actually for the detailed insight into Colombia's proactive strategies and the lessons learned, and the actually highlighting the importance of the bridging humanitarian action with sustainable health solutions and inclusion in the social security agenda. Thank you so much, and hope you can stay with us online. Now, I want to invite Dr. Santino Severoni, Director of the Health and Migration Department at WHO. Dr. Severoni brings a global perspective on how to balance humanitarian health responses with the long-term system strengthening. Dr. Santino, can you hear me?
Yes, thank you very much, Ali. Well, this is a long-standing issue or challenge for whom it's operating in the emergency response and who is dealing with the long-term aspects of the public health implication of migration. The subject is so complex and so long that a lot of effort has been put also in the past to define better what we call technically the nexus between the emergency phase and the long-term implication. The issue of displacement, health and migration, in my view, brings an additional layer of complexity that the topic in relation to the health sector sometimes sounds a new topic, a new issue, confronting with realities where not necessarily the competence is up to the level to deal with bridging the emergency response and the long-term needs. There is another element of complexity. When countries are waived by large influx of displaced or migrant population, we need to recognize that the country is solicited very heavily. All sectors of the country are heavily solicited. This is a very often a resource-intensive response that the country needs to put in place in order to manage this issue. And the need to address life-saving interventions or the need to address immediate solution to really overwhelming challenges might overtake on the perspective that in many cases is the reality accompany those situations, and the contribution of today of Dr. Guevara from Colombia is exactly picturing out that in many cases those countries, they need to realize, yes, they need to confront with a resource-intensive response to the large influx, but then those are populations which they tend to stay long-term in the country of destination. We have in reality where displaced population became population of that country for 80 years, 50 years, 40 years. Colleague from UNHCR that can give more precise data of this reality. However, even in this case, we do know pretty well what we should do in terms of recipe for ideal response. But again, we need to recognize that it's easy to be told and to be done, because this implies integrating the emergency response into long-term vision and actions. And to do that, we require very precise steps. For example, I would identify as a first step dual planning. Really, we need to have the strength and the understanding to engage the country in a dual plan. It means that at the time of emergency response, still we need to have a strategy, a vision on how we want to deal with this situation on the long term. The element of capacity building. Please do not underestimate this element, because we have seen countries with a very high developed and capacity in the health system actually getting into very distressing situations, for example, during the initial stage of Ukrainian displacement. So it's not an issue, if we are thinking that the issue of capacity is a prerogative of low-income setting, we are wrong. The capacity is a cross-cutting challenge needed at all levels. That's why, for example, as a WHO, we invested into developing competencies-based standards and mechanisms to support countries to really lift up quickly the capacity of the healthcare workforce to engage and to address not only short-term, but also long-term. The third recipe ingredients, I would say, is partnership. Partnership which goes across horizontally the different stakeholders, but more important, also top-down from the central government to local community. Again, we should not forget that the highest solicitation usually is with the local communities. And very often we see policy development, we see intervention development at the central level without taking into factor the experience of municipalities, of the community, local community. So it's very important that we start to really bridge the gap or close the intervention between the national response, the national thinking, and the local intervention. Then again, at the level of response, we need to start to think very proactively into scalable solutions. So interventions that can be scaled up then on a long-term perspective. Again, I like to use the Colombian perspective where came clear that this is not a short-term response to the phenomenon of migration from Venezuela. So from having, let's say, allow me to use in bracket the open door tolerant approach, this has been quickly switched into planning concrete technical solutions to embrace in the health system, to include in the health system the majority of this population. And in my view, the data we heard today from the Colombia colleagues presenting her part, I think is this 500,000 people already contributing to the system. So if you launch long-term scalable solution, you can see return also very, very quickly. Last but not least ingredient necessary for a successful approach is the availability of data. And this starts with emergency response. Very often, this also for the aid architecture. There is a sort of silo segregation between the emergency response and what we call technically development. And there is no permeability of data transition from the emergency experiences and the long term. In reality, this is a very important element to be addressed and to start to use data already from the emergency response, but also the specialists of long term, they're supposed to close collaborate with emergency response specialists in order to help them to bring, not to reinvent policy solution, not to reinvent evidence in what is the addressing of the public health aspect of migration in general. So Ali, I would stop here by launching a bit of provocation with 5 concrete directions that in my view are indispensable for a sound response and addressing short-term and long-term needs at the same time. Thank you.
No, thank you so much, Dr. Santino, for actually proposing the recipe for leveraging the humanitarian development nexus in the context of the migration. And in the region that I'm serving, basically, this is the challenge that we are facing every day. However, there are good practices. For instance, right now in Egypt is the focus on strengthening the national health system to be able actually in long term address the needs of the actually influx of the Sudani refugees to the country. Or for instance, in Iraq, strengthening the PHC system to not only serve the host population, but also the IDPs in long term. Thank you so much for the recipe again and the insight, Dr. Santino. Our next speaker is Dr. Poonam Dhawan, Director of the Migration Health Division at IOM, one of our main partners also at regional and country level. Dr. Dhawan, can you hear me?
Very well, thank you.
IOM aligned responding to immediate health needs with contributing to long-term solutions to displacement. Floor is yours.
I'm delighted to be here with you and would like to thank WHO and the Ministry of Health and Social Protection Colombia for including IOM in this panel. Greetings to the esteemed speakers from Colombia, Qatar, and the Philippines, and my partners from WHO and UNHCR. It is a privilege to join you here today. And thank you for your question. At IOM, we firmly understand that health is not just critical in the response phase during a crisis, but an important pathway to finding durable solutions for displaced populations, as well as enabling access to regular migration pathways. So while IOM responds to the immediate health needs of displaced and host populations in crisis, we are committed at the same time to finding solutions to the challenges and promoting the agencies of the populations themselves. We have been committed to the UN Secretary General's agenda on durable solutions and look forward to championing this cause, working closely within the UN system. Strengthening health systems to assure that quality and sustainability remain at the forefront of all health programs. This has been an important lesson learned through decades of IOM experience in public health, whether during pandemics and health emergencies, including COVID-19, or in implementation of migration policies for integrating migrants within host communities, including in cross-border areas. We have heard several important perspectives on this from the esteemed speakers on this panel so far. Carrying out all our health work, saving lives, promoting durable health system solutions, or integrating health within regular migration pathways, closely working with our member states, WHO, UNHCR, other partners, and most importantly, civil society and communities remains key to this approach. We are constantly advocating with our technical cooperation partners as well as donors to support this approach, which is the only way forward to ensure the quality, integrity, and protection that we are committed to offering within our health agenda. Some examples on how we can align immediate health needs with long-term solutions include deploying mobile health teams in crisis settings while working with local health centers to strengthen health systems, ensuring essential health services can be offered as part of return and reintegration, working closely with national disease programs such as NTPs to ensure that we can expand access also in conflict and crisis settings, as well as enhancing the training and capacity development that Santino also alluded to right before. This week in Bogota, I have been reassured, also in meeting with the Colombian authorities, WHO, and other partners, that this is indeed the approach that we are attempting to follow in all that we do, whether at district level to strengthen disease surveillance, or by partnering with local health professionals who are providing support to Colombian communities, to migrants and others to enable them to access regular migration pathways. So in conclusion, I can only emphasize what was posed to IOM as a question, that only by combining emergency response with health system strengthening and inclusive approaches can we truly empower migrants, displaced communities, and work towards advancing this health agenda. I thank you.
Thank you so much, Dr. Davan, for the very clear, actually, the elaboration on the strategies to be used and the examples you provided, and emphasize on the importance of combining emergency response and the health system strengthening as a actually sustainable solution. From my side, I wanted to appreciate the collaboration we have with IOM in MENA region, Eastern Mediterranean region, and we have the examples of working with IOM and partners to basically link the emergency response and health system strengthening. And one of them is the project we have in Iraq, Lebanon, and Jordan on actually on the nexus of the climate change, disaster risk reduction, and human mobility. And we look forward to work with your colleagues in the region to celebrate the International Migrant Day on 18 December. Thank you so much again. Now I want to actually invite Dr. Alan Maina joining us remotely. Dr. Alan is the Chief of the Public Health Section and at UNHCR. Can you hear me?
Hi. I hear you. I hope you can hear me.
Thank you so much for joining us. Dr. Maina, what are the most critical challenges UNHCR faces when providing healthcare in refugee camps during emergencies? And how is UNHCR working with the Ministries of Health and partners to ensure that displaced populations have access to healthcare in both acute and protracted crisis? Over to you.
No, thank you very much, Ali, for this question. Let me remove my specs. I think there's a bit of a reflection, but I hope you see me well and you hear me loud and clear. Congratulations for this excellent meeting. The school has been going on okay and great, and thanks to the government of Colombia for all the support and collaboration, and WHO and IOM. I mean, so I have a short time. I think my time has been reduced to maybe a couple of minutes. So I'll keep it brief and cut a lot of things that I was going to say. So the key challenges that we are facing, first of all, you know the numbers of people displaced. It's now close to 123 million. By mid-2024, the numbers continue going up. The resources are going in a flux. And it's becoming challenging to make sure that we can be able to ensure universal health coverage in very dire circumstances. We're having a more recent situations of conflict, persecution, and violence, as we've seen in Sudan, Ukraine, even recently in Lebanon, but also we have what you call forgotten emergencies. We have DRC and in Myanmar, and we also seen what's happening in Syria. It makes us all remember that we continuously need to be on the guard that make sure that everyone everywhere is able to access healthcare services and be able to adapt accordingly. The main challenges we're seeing around health access itself, high rates of malnutrition, infectious diseases, mental health issues, as some of the speakers have said. We also seen challenges with maternal and infant mortality, also chronic diseases like diabetes and hypertension. And then in terms of way forward, what are we seeing? What are the lessons learned? So I'll say some 5 key points. And one is, as UNHCR, we are working towards realizing at an inflection point, even as humanitarians are working more and more with development actors, with the private sector to find solutions for refugees. And also, more importantly, we have been having discussions with the member states, with governments on how we can provide sustainable models of care that build on the resilience of the refugees, that, for example, helping them get certified to be able to work and earn a living and be able to pay for healthcare and be able to be educated and provide for other needs that they have. So we're evolving as we're going along, and we're happy to have these discussions with the governments and partners, building on the principle of universal health coverage, really. And that builds to the second point on inclusive national policies. And Colombia is a great example of commitment towards human rights and pragmatism with the temporary protection status, the graduation model, allowing the Venezuelan refugees and migrants economic self-sufficiency is a great model to learn from. We also have Chad facing, Chad is a country that is economically challenged and is constantly facing emergencies. And amidst all that, they've found solutions where the government is making a pledge through the Global Refugee Forum to have 50% of facilities included in the national system. World Bank is coming in to support and others. And then quickly just finalize on a couple of points, is that, again, to remember social inclusion, reducing inequalities. We can't just work with making sure refugees and migrants are included without also engaging the hosting communities as well. We also need to strengthen health governance, data, and research. And we're working with the University of Colombia and World Bank and others in documenting these successes. We also need to develop our partnerships and innovative approaches. And we're happy to work with WHO and with the IOM, the Global Action Plan on Health for Refugees and Migrants, and the group of friends of refugees and host communities. Lastly, and more importantly, is engaging the community. And as leaders, as decision makers, but also as change makers, no health reforms can succeed without having the refugees, without having the community themselves at the center of the response. Thank you.
Thank you so much, Dr. Allen. You highlighted several important points. So one of them was the role of the private sector. Actually, with this economic situation worldwide, maybe it's too much to expect the governments in some countries basically to cover everything. And it's very important to see how the private sector capacities can be leveraged while is aligning with the national health policies, strategies, and plan. You also mentioned about the importance of working together under the Global Action Plan. That's super critical. And also, I want to highlight the great work that you are doing, at least in our region, that I'm aware on the durable solution. I know the programs in Somalia, in Afghanistan, and actually basically that's the point that all the partners from the humanitarian development side can come together to address the issues of the refugees and the displacement in protracted emergencies. Thank you so much for joining us today. So thank you to all our panelists for the invaluable contributions, and to also our dear audience for the engagement in the questions if there's that opportunity. Today's discussion has underscored the need to bridge immediate humanitarian responses with a long-term health system strengthening. And let us carry these lessons learned forward to build more resilient and inclusive healthcare systems. Thank you and enjoy the rest of the program. And I will now pass the floor to Claudia and Santino back in Bogota. Thank you.
Thank you. Thank you, Dr. Ali Ardalan, for moderating this panel from El Cairo. I think it was challenging having panelists from different parts of the world, and thank you for the high-level panelists we had that let us know new lessons. Thank you very much. Well, I want to take advantage that I have Dr. Severoni and Dr. Poonam here on the stage in Bogota. Because you represent something that we have discussed during the school, which is the need of collaboration among different institutions, organizations, and levels. And I would like to know from both of you who have the same level, because you both are directors for the same area, which is migration and health, from different institutions, the World Health Organization and the International Organization for Migration. How do you collaborate to face these challenges with migrants and refugees across the world? I don't know, Dr. Poonam, if you want to start.
In 2 words, very well, is what I would say. I believe that, and we've also heard from Mina online from UNHCR. So working closely together has been, in a sense, very key in all the advances made in promoting the health of migrants and refugees. I will, of course, let Santino refer to it with the WHO perspective, WHO being the normative lead in the UN system for health, and also a partner that we closely work with, not only at the global level, but critically at the regional and the country level. You heard from the colleague calling in from Cairo about the cooperation in the MENA region, for example. Here in Colombia, we have been and continue to work more and more closely with the Ministry of Health, together with PAHO Colombia as well as IOM. Of course, there is a lot more that can be done to promote these partnerships. From our part, working on migration, we have been advocating and doing all we can to ensure that health is not left out of migration discussions. So this has meant at the highest policy level, at the UN level, for example, with the Global Compact for promoting for safe, orderly, and regular migration, where WHO has always been a key partner. And with member state recommendation, health has been a key topic for the intersectoral cooperation, or at country level where there may be national migration coordinating mechanisms, there may be emergency response mechanisms through interagency clusters, or there may be intersectoral work for labor migration, for example. In all of this, to promote this partnership, we are trying to make sure that the health sector has a voice and a seat at the table. So I'll pass on to Santino.
Thank you, Poonam. Just to complement, indeed, the collaboration, it's the way to go, I would say. And as a WHO, we try to highlight the specificity of each agency to build on. And we embedded the principle of collaboration even in the WHO resolution, telling us what to do as a WHO. So it's really not only a matter of goodwill, but really a necessity in terms of effectiveness. Not only that, but we are accompanying the, let's say, policy prescription of the resolutions also with a factual agreement of collaboration. And certainly, as Poona was saying, more can be done, because if you look at the specific realities, WHO is probably the youngest partner in this topic, because we brought up the issue of health and migration not long ago. So we are also building WHO vision and best modality to support the issue of displacement health needs or migrants' health needs. And we are living in a moment where WHO really decided to accelerate. The Director General included in the new General Program of Work, and I alluded several times during the school, health and migration will be a WHO global priority item, so inspiring the entire world. Not only, but also we define concrete outcome and output that's supposed to be achieved. We also identify indicators to monitor progress. So it's a major switch in attempting to be really useful for the cause, useful for the challenge. And then there is the human factor. Never forget the human factor, because at the end, the organization are made by human beings. When we're talking about migration and refugees, we're talking about human beings. So Poonam, Maina, and I, we are friends also. Can I say that? So make things more easy. And we are encouraging this also at the regional level. Ali alluded very, very clearly, and at the country level.
I know you have friends in Colombia to keep collaborating.
I love them.
Okay, we have like 2 minutes for one more question for both, which is, you just mentioned the human factor is important. And thinking in our audience, after receiving all this knowledge, how to implement it in the daily life, no? How to organize all this and say, this is my plan, and I'm gonna do it step by step during the next year or whatever it's the situation. What is your advice for them?
Well, this is very much embedded into the evolution of the school itself. We started the school because we realized long ago that there was a gap, there was a caveat. We're supposed to establish a channel of communication, a platform with the health sector, but also targeting policy makers, managers, decision makers, which sometimes they don't have really detailed knowledge of the reality on the ground. What are the mechanics? What are the challenges? What are the details of the situation? But then soon we realized that we're supposed to open up the door for broader audience. So we are not anymore specifically targeting, but we are having an open approach. And this, it's amazing to see how the country participation is growing with the time, but also we have a very large academia interest, young professional, international organizations, civil societies, NGOs willing to attend the school. And the overall aim there became to create a critical mass of people to whom we can offer a bit of knowledge sharing to help them to have some argument to hang on in the frame, in the time of performing their activity. I think the message was given yesterday by Dr. Jeremy Farrar. Please take home what you are discussing in the conference. Don't let this stay into the conference place and you forget it. So I think the way to go is that each one of us, each one attending the school has been receiving a portfolio of very rich experiences, testimony, and sharing, and they're supposed to try to start applying those on the ground. There is an hidden element also that if you look a little bit from a step back what's going on, this is also a network. Please use this network. Please connect, stay in touch, help each other. So this is the aim of the school and what we are looking for to achieve. Thank you.
Sure. Actually, I was about to quote Dr. Farral yesterday's message when he said, "We don't change the world in the meetings. Changing the world is what we do once we leave the meetings." So the invitation is for all of us to set a goal to apply this knowledge. Dr. Poonam, I don't know if you want to add something else? No? Okay. So thank you very much, Dr. Severoni. This is the end of our edition.
Thank you to Poonam to be here in
Thank you, yes. You're coming from
Geneva.
Geneva too. Wow, thank you very much. Friends travel together too? You have friends in Colombia too? Ah, friends travel, both of you. Okay, thank you. Well, this is the end of our school, the 5th edition of the school, and I want to thank Dr. Severoni and of course Candelaria and the whole team for inviting me to be part of this event. It's been really important for me to learn from all of you and to see the commitment of you to get new information, new tools to keep working with migrants and refugees and guaranteeing to them the health services. So Dr. Severoni, it's been a pleasure. Thank you for having me here.
Are we closing?
Yes.
Wow. So soon?
Yeah.
What an incredible journey, right?
Yes.
I really enjoy. I think Colombia will stay unforgettable as an experience, but also the overwhelming support. Now, Claudia, I'm a bit of daunting because I'm having the most difficult challenge, not to forget anybody, but very important that I'm reminding to all that what you have seen for this entire week is the result of an army of enthusiastic friends, experts, that have been collaborating to make the school possible. So allow me to start. My team is so efficient, they gave me a list. So if I'm forgetting...
Your team is unbelievable.
Unbelievable, fully agree.
Do everything perfect.
So, but I need to start by really thanking the Ministry of Health of Colombia, Ministry of Health and Social Protection. Since the first day I came to Colombia and I mentioned to the Ministry of Health the idea of a school, the response was yes, yes, yes. So really full support. And this is incredible and unforgettable. So thank you to Dr. Guillermo Jaramillo for his support, and through him, the entire Ministry of Health team. But also before to come to Colombia, I stopped over in Washington to speak with the Dr. Jarbas Barbosa, the regional director of PAHO, and again, meeting with him and the team, was very encouraging to see, yes, we want to do that, so really support also from them. And down the line, but not less important, Ciro Ugarte, I renamed him Duarte, joking, since I was renamed as well during the school. So Ciro Ugarte had been really a fantastic companion in this journey. He trusts on us fully, immediately, and he just play incredible role in facilitating. Gina had been the most special support, because really gentle, always in, how to say, a little bit behind the stage, but really securing fantastic support to the preparation. Preparation which took more than 8 months. This is the work behind each school. Wow. And of course, the school was not possible without the participation of the audience, those also here. This year we were so impressed by the fact that Colombia story is so fascinating, the program of this year so fascinating, that we had friends which, despite we told them, look, the school in reality happened virtually. What you see in Colombia is a backstage of a sort of TV show. We had friends, colleagues traveling from Switzerland, Egypt, Canada, Philippines. Really, they wanted to be here with you, with Colombian colleagues in person. They wanted to really be here to participate actively. This has been really overwhelming in terms of response and feelings behind that. The school is characterized by production, original production. Colleagues, they are really working restless to develop a set of video, what you have seen the entire week. Those are specifically made for this day's discussion. The videos are staying available on WHO website, and we are having information that the visualization is really overwhelming, and we are very pleased about that. But behind that, again, there is a huge work with the WHO regional offices, and huge work with the health authority of the country that you have seen involved, like South Sudan, Brazil, Jordan, Italy, Colombia, Thailand, and Estonia. So thank you very much for believing in us and investing into us and the school. Same with keynote speaker. We took away from their own routine and their own busy agenda a number of people, and we are thanking them really. We are conveying to them heartfelt thanks for being available. I don't think it's only a matter of interest on the topic, but really of relationship. As I said before, the school is made also of contact and relationship. So Professor Carl Blanchett, Kira, Josephine Borghi, Dr. Jeremy Farrar, I really enjoy. I think they gave us masterpieces of technical work. Could be easily a lesson for a PhD or a master course. So I was really impressed and really thankful to them. The panelists of today we switch approach, because we like to conclude, just to give you a bit of information, by encouraging sharing of view among the stakeholders, key stakeholders involved into this topic. So that's why we changed the format of last day, and I'm very thankful to all of them, starting with Dr. Kenneth Roquillo, Dr. Albayet, Dr. Nieto Guevara, impressive presentation, my friend Poonam Davan and Alan Maina, but then also big thanks to Celso and Ali for a fantastic moderation. Not easy, because doing the job partially here and partially remote is not easy. Now, Claudia, with your permission, I'd like to do, actually I'd like you to announce the surprise.
The surprise. And yes. Thank you also to Dr. Cavieses, who moderated the...
I'm going. I have a solid list. Don't spoil. Don't do spoiling.
Okay. Our surprise is a video, not a video reportage, but a video package, if you want to call that way. We prepared from these 5 days, so let's watch it and enjoy it.
And now I'd like to start by thanking two special women accompanying us for the entire week. Claudia, thank you so much. You were fantastic. And Baltica Cabieses, Professor Cabieses, please join on the stage. Join on the stage, please, for the closure. Now the team is partially here and partially in remote, so allow me to give you a few more names, and I want to invite the team present here in the room on the stage. Please, Baltica, come here. Candelaria, fantastic job. She was, friends, they renamed her Alexa, because she was able to provide all possible answers and solutions to problems. Thank you, Candelaria, fantastic job. Then Dr. Annunziata, I like to hide always, but is behind the engineering of the faculty, the content of the faculty. And Pino is working with me since the first ever school. Pino, we don't say when, because otherwise people understand our age, so better not to mention. Pino. Then we have a mixed team, as I said, partially here and partially remote. Claudia Marotta, which has been behind the screen, following us all the analysis and the question selection. Daniela Timus, Irina Alexeyeva, Kaula Nasser, Silvia Garri, Saverio Bellizzi, which is here. Saverio, please come on the stage. Miriam Orkut, that you have seen yesterday. And Jos Belaro. Jos, I don't see you. Where are you, Jos? Where are you hiding? Please come on the stage. This is the global team, but without our regional and country team, we were not doing anything. So, Celso, please don't hide. Join us. Mauricio, please. Laura, please. I spot on before. You guys, you're hiding. Please don't. Come here. Do we have any other colleagues from the country office hiding here in the audience? Please join. Please come on the stage. Yes, please come close. Please come on the stage. Please come on the stage for the last look. Look at the crew behind this adventure, behind this journey. So thank you. Thank you very much to everybody. And we're really going to keep you with us in our heart for this incredible experience. Thank you very much. Thanks a lot.
We will have a family picture here. And for those who are virtually attending,
oh my God. We are missing. I told you, the lists are dangerous. I told you.
He celebrated birthday while we were here.
Come here. Cetin, this guy is among the most precious person because we call him troubleshooter. Whatever doesn't function is fixing in real time. It's really, sorry Cetin, you are hiding very well.
And happy birthday, because he had his birthday.
This week Cetin also celebrated happy birthday with all of us here in the school, so double effort. Thank you very much, thanks a lot. Again, one last applause.
Bye. Happy Merry Christmas and Happy Hanukkah for those who celebrate these holidays, and happy rest of the year if you are in Gregorian calendar, and hope we see each other in other moments. Thank you very much. Bye-bye.
That big red, huh?
Good.